Do you want to fix hunchback posture? Imagine being able to stand up tall effortlessly without neck or back discomfort. Hi, I'm Dr. Dave Candy, and in this video, I'm going to show you a little known secret to fix hunchback posture without doing hundreds of chin tucks or upper back exercises. See, most treatments for hunchback posture just treat the symptoms without addressing the underlying root cause. But if you were going to fix a building that's leaning over, you probably wouldn't start at the top floor, right? Well, that's exactly what you're doing by doing chin tucks or upper back exercises. And so if you really want to fix hunchback posture, you need to start down at the foundation. Your spine has a natural S-shaped curve, and the position of each segment is dependent on the segments below it. Now, your upper back normally should have a little bit of rounding, and neither too little nor too much is good. But one thing that spine model doesn't show is that your rib cage significantly affects the posture of your upper back. And if you can't expand your rib cage through breathing, then you're going to find it really difficult to fix hunchback posture. And so to fix hunchback posture the easy way, it starts with breathing properly. Now, to learn how to do that, sit down in a firm, straight back chair and scoot back all the way so that your lower back is flat up against the backrest. Now, don't worry if your upper back or your shoulders don't touch right away. In fact, if you have hunchback posture, it's very likely that your upper back and shoulders won't touch. Next, take your hands and put them on your lower ribs and your abdominals, just like this. Then breathe in by pushing your belly out, and you should feel your belly expand forwards into your hands as well as sideways, and you should also feel your lower ribs kind of push out sideways. Additionally, you should feel your lower back press into the chair. You don't want it to arch up like that. So again, breathe in by pushing your belly out, and then relax and breathe out. Now, that's just the opposite of the way that many people breathe, but that's the way that your body was naturally designed to breathe. You see, your diaphragm is the main breathing muscle, and it's a dome-shaped muscle that separates your lungs from your abdominal cavity. Now, in its relaxed position, the dome of the diaphragm is up. But when you contract the diaphragm, that dome flattens down, and it increases the volume inside your lungs and your rib cage. At the same time, your rib cage expands a little bit, and that increased volume creates a negative pressure inside your lungs, and then air rushes from outside your body into your lungs to fill that empty space. Then when you breathe out, the diaphragm relaxes, that dome pushes back up, your rib cage moves back down, and that forces air back out of your lungs. Now, if you're not using your diaphragm properly, then your rib cage isn't going to expand, you're not going to increase that lung volume, and as a result of the rib cage staying depressed, you form a hunchback posture. But you still have to breathe somehow, and your body finds alternate ways to do that by using your upper trapezius muscles or your sternocleidomastoid or your scalene muscles. You can see those muscles activate if you breathe in quickly or sniff like this. So if you're not using your diaphragm properly, not only are your ribs staying depressed, but you're activating those neck muscles. And another effect of that is they pull your neck forward to open your airway, kind of like the head tilt chin lift position that's used to open the airway in CPR. And the net result is you have both a hunchback posture and a forward head. So to fix those things, it starts out by using your diaphragm properly to breathe. And to review that, sit all the way back up against the chair so that your lower back is flat. Push your belly out. Feel your rib cage expand. And then let everything relax and the air flows back out naturally. Now notice you're not making the breath sounds when you do this. So you're not doing, in fact, you can see when I do that the neck muscles activate. There should be a quiet, relaxed breathing where you're just pushing your belly out, feeling the rib cage expand, and then letting it fall. And try taking quiet breaths like that, belly out, Just focus on the belly rise and the belly fall. You don't have to think too much about coordinating breathing. Air is going to flow naturally. Just think about belly out and belly in. Belly out and belly in. Belly out and belly in. And after doing that for 3 to 5 minutes, take note of your posture, and you'll notice that you can come more upright through your upper back because your rib cage has expanded and it's not pulling you down into that hunchback kyphotic posture. So that's how you fix hunchback posture while you're sitting. But eventually you have to stand back up. And the mechanics of breathing when you're standing are exactly the same, but instead of the base of your building being down at your pelvis, it's now over top of your feet. And so now you have to balance your pelvis over top of your feet while still doing all those same breathing mechanics. Now, to fix your base of support, start out in a comfortable standing position and just let your feet fall where they naturally would. Then wherever that is, shift from side to side until you have equal weight on both feet. So there's not more on one side or more on the other, but you have pretty much equal weight on both feet. Then shift forwards to backwards and kind of get the pressure equally distributed between your toes and your heels. It shouldn't be too far forwards or too far backwards. Then turn your knees out so that they're facing over your toes, whether that's straight ahead or slightly inwards or slightly outwards. Wherever your toes have fallen, move your knees out so that they're in line. Then you're going to want to roll your pelvis underneath of you and push your hips forwards to get your pelvis set. And now that you've got your pelvis set over top of your feet, then you want to start taking those diaphragmatic breaths again. Belly out, expand the rib cage, and let it fall. And that'll help get your upper back or thoracic spine in a better position. Now, if you still feel like you're leaning forwards a little bit, chances are that your hip flexors are a little bit tight. And the easiest way to get to an upright position instantaneously is just by bending your knees a little bit. That'll allow you to roll your pelvis underneath a little bit more, and then your upper back is straight. Now, in the long term, you are probably going to want to stretch your hip flexors out. And there are some easy ways to do that. I'll link to 2 videos over here about how to stand longer and how to walk without a hunchback posture. But before you go, if you found this video helpful, give it a like. And if you haven't already, subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.